The Dental Depot by Corey Rex. Here we have the front of the office, which is the main entrance to the building. Here's the main lobby or waiting room for any patient waiting for their upcoming appointment, but as you can see, for the time being, it is empty. Behind here is where the receptionists work, taking any calls and planning the day's schedule. In this little room is where all the patient filing is done, and these are all of the patients from the past 6 years. Here on the left, you briefly see an x-ray machine as we walk past and enter the back hallway heading towards the storage room.
I'm wondering where I can find me some trash bags.
The storage room for the time being is actually quite empty, but for the most part it's typically filled with gloves, toothpaste, floss, and any other equipment used throughout the day. Upon exiting, we turn right and head down the rear side hallway as we are heading towards the hygienist room.
Cormeister. Oh no, Corey, you have me on camera.
Haha, yeah, Jody, I did get you on camera. But what we're doing now actually is entering room 5, which is like the overflow room when Dr. Ginger has rooms 1 and 2 full. And as you can see right now, it's empty, but you can hear a high-pitched buzzing noise, which is actually coming from Kamala's room next door, and what she's doing is using her high speed on her patient. In this little drawer here, we have the little caps, which are full of filling material for when you have a cavity in your tooth and it gets drilled out and you get the actual filling. There's also numbing jelly, which is used when a patient doesn't necessarily need a shot, but needs to get their mouth a little numb. And there are also the actual tubes of numbing substance in there as well. As we turn right out of room 5, we walk past Kamala's room, who did a brief interview for me.
Okay, my name is Kamala Richards. I'm a dental hygienist here at the Athens Dental Depot. I recently graduated in June 2012 from the Ohio State University. I have my Bachelor of Science in Dental Hygiene, and I also participated in the AFTA program, which is Expanded Functions Dental Auxiliary. I can do fillings, I can do local anesthetic, I can do nitrous, and I can also do hygiene appointments. I've been working here since June. This is my first job right out of school. I also work on Fridays at Nationwide Children's Hospital, and it's pediatric trauma, and it's very quick-based, and it's a hospital setting, so it's a little bit different than private practice. Here in private practice, it's hygiene, it's therapy. We set up the doctor for diagnostics and treatment. He prescribes and diagnoses, and we just educate the patient and do therapy and hygiene and follow up with a recall system. As far as hygiene, I recommend it to anybody. We have a very flexible schedule. I work here 4 days a week, Monday through Thursday, 8 to 5. Holidays are off, weekends are off, and you can work 312s if you'd like. So it's very flexible, and it's good for any female or male. As far as Corey, he's more interested in dentistry. Corey would probably not go through dental hygiene, but he would go through pre-dental, and he would eventually go on to become a dentist. While Corey was here since August, he came 5 days a week for a couple hours each day. Corey did some assisting. He did a lot in the stock room. He would stock our supplies. He was helping with the orders. Corey would set up our trays. Hygiene uses a certain tray. The doctors use a tray with their certain supplies. The assistants use a tray. So Corey got to know a lot about little things that we use to make our day run smoother. We would have these trays ready in the morning, and they would get us through the entire day. Corey also set in on many appointments, whether it was fillings, surgical therapy, hygiene therapy, or just patient education, deep cleanings, root canals, crowns, any cosmetic work. And he would listen and become a part of our patient education base. He would listen to the doctor's therapy. He would also listen on behalf of our hygiene therapy. He also worked side by side with the assistants. And Corey has just kind of gotten a feel for dentistry, dental hygiene, dental assisting, The front desk, you can't have a successful practice without the front desk. And Corey's gotten to know a little bit about everything here. So we're glad to have Corey, and good luck in your future.
After leaving Kamala's room, we go into the area where I make the actual trays for the hygienist to use, and this is where the autoclave is, as well as the ultrasonic for cleaning the utensils. Here are some tools actually in the ultrasonic, and here's a little packet of tools getting ready to enter the autoclave. Here we have several packets that I made for the hygienists, and they will use them periodically throughout the day. Next, we have myself here making a packet for the hygienist. So we have a tray and a paper film that covers the bottom. Lay down some gauze, as well as a air and water top, and a suction as well as that. Next comes a polisher and some polish to go with it. And then I briefly take a second here as I struggle to get some floss. Upon getting the floss on the tray, I'm then complete with everything, and I place a bib on top for the patient and am ready to go. Upon finishing making the trays, we then enter room 1 and take a brief look, pretty much the same as room 5, and then we stop and take a look at the x-ray machine. This little pad here is what you press when looking to take a patient's x-ray picture, and this is the device that takes the actual picture and is placed next to their mouth. We then exit room 1 and head back towards the front, where we make a brief entrance into the workroom, which is where they do fittings for mouth guards, dentures, and stuff of that nature. And here we have 2 grinders that are used when adjusting the fitting of a mold or anything of that nature. And lastly, here are several molds and dentures that have been done at the dental depot. I then exit the equipment room and head back towards the front desk, where I then will enter the front of the building and have completed our tour. I'd just like to end by thanking everyone at the Dental Depot. It was such an awesome experience to be there and have them welcome me into their business and let me be a part of their life for several months. My time I had was awesome. I learned so much, and I feel that it will benefit me a ton in my future, and I'm grateful for that, and I thank everyone there.